Welcome to Health Chat. I'm Dr. Alancia Wynn. I was just taking a moment to appreciate my lungs. Now, lungs are one of those parts of the body that we never think about when they're working well, and they work great most of the time. They bring the good oxygen in, they get rid of the bad carbon dioxide, they get that oxygen, have it available to all of our tissues throughout our body. They do amazing things for us, and we don't even pay attention to them when they're working well. But the problems come when they stop working well. So that's what we're going to be talking about today a little bit. We're going to talk about a couple of things that can go wrong with the lungs. Obviously, there are hundreds of things that can go wrong with the lungs, but today we're going to talk about some of the more common ones, some of the terms you may have heard. You may have these conditions. You may have friends or loved ones that have these conditions. So we can talk a little bit about what causes them and what you do about it and how you treat them and all that good stuff. So I want to start with showing you where the lungs are in the body. We're going to talk about kind of the parts of them as well. So here's my friend, Mr. Body. So we're going to open him up here and show you where those lungs live. So you can see this is right in the middle of the chest. And there they are. These two little things are right there. Those are your lungs. And they connect right to what is called the trachea here that goes up through you. That's called the windpipe. And so that's where the oxygen comes in. So when you breathe in, it goes down your throat into this trachea and then breaks out into the other tubes that are called the pharynx. So if you see here on this drawing, it's kind of a schematic picture. You can see the trachea that I was talking about in the middle, and then it drops off into those two tubes, which are called the pharynx, the bronchi, the main bronchi is what they're called. And then you can see those next little tubes, and then little tubes, and then little tubes still, and then you see the little edges, the little balls on the edges. Those little balls on the edges are what are called the alveoli sac. That's where the magic happens. That's where that oxygen gets traded in for that CO2. So as you breathe in, that oxygen comes in and it goes through those little tubes into the little tiny blood vessels, and which then gets carried out to the body, and that carbon dioxide gets put in its place, and when you breathe out it goes back up the same way that oxygen came in, and when you breathe out the CO2 goes out. That is Physiology 101. That's all we need to go about talking about with that. So now we know how things are supposed to work. Now we're going to talk about how things go wrong when they don't work well. Thank you, Mr. Body. We're going to move you over here out of the way. So the first thing we're going to talk to you about today is asthma. Now what asthma is a blockage of normal airflow in and out of the lungs. So it affects those tubes that we were talking about, the big tubes and then the little tubes. And so what causes the asthma attacks, the episodes when you have the symptoms, it can be caused by any irritants in the air, like dust or pollen or anything like that. If you have allergies, if you have a lot of nasal congestion from your allergies, that can also cause a flare-up of your symptoms. Now, what happens during an asthma attack or an asthma, when you have the asthma symptoms, it causes the lining of those bronchial tubes to get swollen. And so if you think about your nose when you have a cold or you have allergies, you know how the inside of your nose gets all plugged up and congested? Same thing happens in those bronchial tubes. So those tubes, the lining of them, they get swollen, they get thick, and when the lining gets inflamed, it causes all this mucus to be produced. And the other thing that happens is those tubes themselves actually get smaller. So instead of being this big, they're suddenly this big. So when those muscles get constricted like that, you're suddenly breathing. You can kind of think of them like breathing through a soda straw. So instead of breathing through a garden hose, now you're trying to breathe through a soda straw. And that muscle constriction is what causes that wheezing sound that you hear when people have an asthma attack. It's a pretty classic sign. It kind of sounds like that. It's a little bit of a whistle sound. You may have had people, or you yourself may have had this happen when you have what's called acute bronchitis, because it's almost the same kind of thing happening when you have bronchitis as someone who has asthma. The difference is when you have bronchitis, it's caused by an infection. But you have that same thing. You have the inflammation of that lining of those tubes. You have that constriction of the tubes themselves. And so the symptoms are the same. You get coughing, you get wheezing, shortness of breath, all that kind of stuff. The difference is asthma is not something that you have once and then it's gone, like bronchitis. Asthma is something that happens when you have it for years. It's not just a one episode kind of thing. So who gets asthma? It can affect all ages, but 50% of the cases that are newly diagnosed are in children under the age of 10. In children, boys are more commonly diagnosed than girls. But when it's diagnosed in adults, women are diagnosed more than men. So we don't understand why. The good news is that half of the children who are diagnosed with asthma will outgrow the condition at some point in their life, maybe in their teens, in their young adulthood, but 50% of them will outgrow it at some point. Sometimes people who outgrow it, they have asthma as a child, they outgrow it, it may come back later in life, depending on kind of what their exposures to things are, and we'll talk about that a little bit in a few minutes. So what are the symptoms of asthma episodes? Because and the reason I keep mentioning these asthma episodes or asthma attacks is that if you have asthma in between your attacks or in between your episodes, you're fine. You don't have any symptoms. It's not something that you have symptoms all the time, every day, no matter what. So the most common symptom of asthma is wheezing, that sound I demonstrated a few minutes ago. People will also have a lot of coughing, especially at night, and it may be productive. So you may be coughing up a bunch of mucus, and that's all that mucus that is getting developed from those tubes, from the lining of the tubes that are all inflamed and producing all that mucus. Sometimes you can have, depending on the severity of the attack, if you have a really severe attack, you can wind up breathing really rapidly, really shallow, and you have trouble breathing if you lie down. You breathe better when you're sitting up. And it gradually gets worse, and you have the shortness of breath that gradually gets worse. If it is a severe attack, your heart rate will get faster, your breathing rate will get faster, your breathing will get more and more labored, which means you're working harder and harder trying to get air in. And eventually you may get to the point where you're unable to speak more than a few words without stopping for breath. You're kind of talking like this. Also, sometimes people, if they have a real severe attack, they can get anxious, which makes the asthma symptoms worse. They can start sweating, and then they get distressed. So you can have this emotional distress because you know you can't breathe, which then causes more anxiety, which then causes more symptoms, which then causes more anxiety. So it's kind of this feedback loop. So it's over and over, so it just gets worse and worse and worse as time goes on. So what causes asthma? Well, we don't really know what causes asthma, but we think it has a genetic component because it does tend to run in families. And the risk for developing asthma is also increased if you have any other allergies like eczema or hay fever. In fact, that's what we call the allergic triad, which means people who have one of these typically have some form of all three, or at least two out of the three, but most typically they have all three. And the asthma, so eczema, hay fever, asthma are the three things that tend to get lumped together in this allergic triad. As I said before, family history for asthma will increase your risk for developing asthma. And the more people in your family that have asthma and the closer they are related to you, the higher your risk. So if you have a parent with asthma, you're more likely to develop asthma than if you had a grandparent or a great-grandparent or a second cousin twice removed that had asthma. Also, if you have exposure to allergens or air pollutants, you're more likely to develop the asthma symptoms, and because again that triggers those kind of spasms in your lungs, and that's what causes the symptoms. Exposure to smoke, whether you're a smoker or you're exposed to secondhand smoke, increases your risk for developing asthma as well. And exposure to any type of occupational irritants like fumes, gases, latex products, metals, anything that can have this particulate matter in the air that you can breathe in that gets into your lungs that can irritate the lining. In fact, there are some people who develop asthma as adults strictly from exposure to either occupational irritants or social irritants. They smoke, or they live with someone who smokes, or they work in a environment where they're exposed to fumes and gases and they don't have the proper breathing apparatus to protect them. So, and the more of these triggers you have, the more likely you are to develop the symptoms. Again, these things don't cause asthma, but if you do have asthma, these are the things that can trigger an attack. So, what's the treatment? So the treatment is to minimize the number of attacks you have. Because again, if you have asthma in between your attacks, you are normal, you're functioning, you do everything that a person who does not have asthma does. It's just those attacks that can impact your life. Because when you're in the middle of an attack, obviously, depending on the severity of the attack, kids can miss school, adults can miss work, it's hard for them to do things around the house, it's hard for them to go out and do things because they're having trouble breathing. They don't want to move around a lot, they really just kind of want to sit or lie in bed until their symptoms go away. And so there are several different ways we can treat asthma. The main thing, number one thing, is to avoid the trigger. So if you can figure out what your triggers are, then you can avoid them. It's hard, especially in this area, to avoid all the air pollution, because we have some pretty bad ozone days and things like that. But if you do have asthma, you want to pay attention to the news reports, because if you hear them say it's an orange alert day or a red alert day, if you have lung disease, you want to stay inside, pay attention to that, because that usually means that there's more pollution, more pollutants, more most particulate matter in the air, which will make your symptoms worse if you're outside, especially if you are exercising a lot. Oh, that's one thing I forgot to mention when we were talking about triggers. Some people can have what is called exercise-induced asthma, which means the only time they have their symptoms is when they exercise. And so the treatment for them is kind of the same, but I'll talk about the slight difference as we're talking about the treatment. So avoiding the trigger is number one. Obviously, if you have exercise-induced asthma, you don't want to avoid the trigger, but you want to manage the trigger. So most people, they start off with an inhaler that they use just as needed, which means when they have their symptoms, they use their inhaler. If you have times when you know you're going to have symptoms, like if you have someone that has exercise-induced asthma, you can use your inhaler before you're exposed to your trigger, and that decreases the likelihood that you'll have an attack because of that trigger. If the as-needed medicines don't work, there are certainly daily medicines, either daily inhalers or pills, lots of different treatments. If it's allergy-related, sometimes getting allergy shots to control your allergies will decrease your symptoms of your asthma. Counseling, if the asthma is anxiety-related, which sometimes can happen. And lifestyle changes. If you smoke, you definitely want to stop smoking. If you're around someone that smokes, you want to encourage them to stop smoking. If you work in an area that you're exposed to particulate matter, talk to your company about getting a respirator or some type of protection, or maybe moving to another area that does not have that same exposure. You want to make sure you get that flu shot every year, and you want to make sure you get a pneumonia vaccine, because people who have asthma are at higher risk for developing complications from both the flu and pneumonia just from having asthma. So the next thing we want to talk about is what is called COPD, or chronic obstructive pulmonary disease. Now, this includes both chronic bronchitis and emphysema. So you may have heard those terms before, and you've heard COPD and you think that's three different things. Not really. Chronic bronchitis and emphysema are both forms of COPD. So we kind of lump them both together under the umbrella of COPD because the symptoms are pretty much the same and the treatment is pretty much the same. And the slight differences are not enough to really go into here. So the signs and symptoms of an attack of COPD is you have this frequent productive cough, shortness of breath, wheezing, just like you have in asthma. The difference is with COPD, it's not something that comes and goes. Well, it comes and goes a little bit. And what I mean by that is most people with COPD, especially as it progresses, they typically have symptoms all the time. They have symptoms every day. It's not like someone with asthma where they are fine 99% of the time, but then they get a cold or they're exposed to smoke or they are outside in pollution and then they have an attack. People with COPD typically have more common symptoms, and eventually they get to the point where they're having symptoms all the time. As the condition progresses, they can even have weight loss because they're working so hard to try to breathe. And it also increases their risk for lung infections, just having the COPD. So what are the risks for developing COPD? Number 1 through number 10 is smoking. The vast majority of people who develop COPD have either been a smoker themselves or they have been exposed to secondhand smoke. But also chronic exposure to dust, ozone, certain chemicals like we talked about, traffic exhaust, sulfur, any of those kind of pollutants. Chronic exposure to that can certainly cause COPD. People who work in smokehouses and things like that can develop COPD as they get older. If you are someone who has had frequent lung infections when you were a child, you can sometimes get scars in your lungs, and that predisposes you to developing the COPD. And just normal aging. Some people just develop COPD over time just from normal aging. And as I mentioned before, the condition typically worsens over time, whereas when it starts, you may only have symptoms a few days out of the month, and then it starts getting worse and worse where you're having symptoms all day, every day. So what's the treatment for it? Since causes number 1 through 10 is smoking, treatments number 1 through 10 is to stop smoking. So if you are a smoker, you need to stop smoking. If you are around secondhand smoke, you need to encourage that person to stop smoking. Because even if the damage has already been done, I hear all the time, Doc, I've already got COPD. Why do I want to stop smoking now? The damage has already been done. Well, yes, there's damage that's already been done, but if you stop smoking, you are no longer doing additional damage, and your lungs will try to repair the damage that has already been done. So you may actually have some improvement in your lung function if you stop smoking. So it's never too late to stop smoking. So don't let anybody tell you that it's ever too late to stop. It is never too late to stop. And along with that, you want to make some lifestyle changes. If you are exposed to irritants, if you are, around the secondhand smoke like I talked about, if you work in an area where you're exposed to this pollutants, you want to make those kind of lifestyle changes. If you are someone who is overweight, that typically makes your lungs have to work harder. So it's a good idea to try to lose weight so that your lungs don't have to work. It's not affecting the lungs themselves, but it's affecting the amount of work that your respiratory muscles have to do to overcome the changes in your lungs. So that's always a good idea. There are several different medicines that are used to treat COPD. Some of them are inhaled, some of them are pills. Sometimes you need a combination of them, and sometimes you'll get recommended to have special exercises, special breathing exercises to strengthen those respiratory muscles. You may need surgery, depending on kind of what's going on. They may need to remove part of your lung or something like that. And as the condition worsens, you may even wind up needing to be on oxygen. Sometimes people start off needing just oxygen just sometimes, but eventually as it progresses, you wind up needing oxygen all the time. And just like people who have asthma, people with COPD should get that flu shot every year, and you should get that pneumonia vaccine. Because again, you're at higher risk for developing complications. So if you get the flu, you're much more likely to get pneumonia or get a severe infection and wind up really, really sick in the hospital, potentially even dying, just because of the fact that you have this COPD on top of it. You want to avoid excessive heat or cold, because both of those can cause kind of that spasm, just like in asthma can cause spasms in your breathing tubes, which will make it harder for you to breathe. You also want to avoid those high altitudes, just like with asthma, because of the lower oxygen saturation in the air, you can't get enough oxygen in. And you want to ask your doctor about flying, because in airplanes, even though you don't feel the altitude, you are at a higher altitude than if you are at sea level. So you want to ask your doctor about flying. Some people need to use oxygen if they fly, even if they don't need oxygen at sea level or during their daily life. And if it gets bad enough, they may want to talk to you about doing a lung transplant as well. So the last big topic I want to talk to you about today is lung cancer. So lung cancer can affect the lungs, obviously, and it affects both sexes, and it usually has an onset somewhere between the ages of 40 and 70. It kills more people in the United States than any other cancer, and the numbers of lung cancer sufferers continues to rise, and it is related almost exclusively to smoking. Either you smoke or you are around secondhand smoke. Again, there are some people who develop it and they've never had any exposure to smoke, but those are rare. The vast majority of people have had some exposure to smoking over an extended period of time. So what are the signs and symptoms of lung cancer? Unfortunately, you're symptom-free in the early stages. So sometime by the time you're developing symptoms, you have already got pretty advanced disease. So you're symptom-free in the early stages, and then you start developing a cough, which becomes more and more persistent. You may have some of that same wheezing like you had in COPD or asthma. You may be getting chest pain from the congestion in your lungs. You start feeling weak. You start feeling fatigued and tired. You start losing weight. And now lung cancer can spread to other parts of the body. So usually when lung cancer starts, it starts off as one tumor. And then that tumor will get bigger, and then it can spread to other parts of the body. It can spread to your bones, it can spread to your liver, it can spread to the other lung on the other side, it can spread to your brain, it can spread to several different parts of the body. So sometimes the symptoms you're having are related to where the tumor has spread to. So you may have shoulder pain, you may have arm pain, you may have back pain, you may have headaches. You may start developing jaundice, which is where your eyes or your skin turn yellow if it's affecting your liver. So you may have other symptoms that you don't think of as lung-related because it's already spread to another organ and you're having the symptoms of the organ. And another common symptom that people have from lung cancer is coughing up blood. Sometimes it's just little streaks of blood in the sputum when they cough up. Sometimes it's just nothing but blood that they're coughing up. And so the risk factors for developing lung cancer is age over 60. Remember I said it can be anywhere from 40 to 70 is when it typically starts. So the more you advance past the age of 60, the higher risk you are. Smoking, we've already talked about. Secondhand smoke, again, is a risk factor. Also, radon gas is a risk for developing lung cancer, which is an odorless gas that comes from the ground that can get into your home. You won't see it, you won't taste it, you won't even know it's there, but if you're exposed to it, it can cause lung cancer. Other lung diseases, so people who have COPD can develop lung cancer. Other lung diseases can predispose you to developing lung cancer as well. If you are exposed to things like asbestos or uranium, nickel, or some other chemicals, or air pollution, the chronic exposure to any of those things can increase your risk for developing lung cancer. And especially if you are someone who's exposed to multiple chemicals. So if you're working in a lot of people who were in the military back in the 40s and 30s before we knew about the risk of all these chemicals, they were exposed to these things for extended periods of time, years even, with no protection at all because we didn't know. So what are the treatments for lung cancer? Well, there are several. The big three is surgery, chemotherapy, or radiation, or some combination thereof. And the treatment options kind of depend on when you get diagnosed, excuse me, and if it's spread beyond the lungs or not. If you have one small tumor and it's in one part of your lung, a lot of times surgery, they can go in and remove it, and then they'll just need to monitor you. If it has already spread, if it's spread through multiple parts of the lung, they still may be able to remove either a bigger part of the lung or the whole lung, and then they may want to do chemotherapy or radiation in addition to that. If it's already spread to other parts of your body, say your liver or your brain or your bones, then surgery is not really going to help because you can't really do surgery in multiple parts of the body. So then you're looking at chemotherapy and or radiation. And the more advanced the disease is when it's caught, the harder it is to treat. Obviously, it's a lot easier to treat a little 1-inch tumor that you can just cut out than something that is already spread. So that's the bad part about it being so symptom-free for so long, is that a lot of times by the time you start having symptoms, as I said before, it is already starting to spread throughout your body, and then it makes it harder to treat. So how do you prevent lung cancer? Number one is you don't smoke. Number two is if you smoke now, stop. If you are around someone else who smokes, get them to stop. Not only does that decrease their risk for developing lung cancer, it decreases your risk for developing lung cancer as well. And another important thing is you want to obtain regular checkups from your doctor because depending on how much you smoke, they may want to do a chest x-ray even if you're not having symptoms to see if there's anything suspicious going on. They may want to do it every year or every 2 years or every 3 years, depending on how long you've been smoking, how much you've been smoking, what other risk factors you may have. But it's key to see your doctor on a regular basis so they can do those tests before you start having symptoms. So if something does develop, they can catch it earlier rather than later. And then you remember I talked about radon gas, that odorless, colorless, smellless, tasteless gas that comes up from the ground. There are ways you can have your home checked for radon, and that's always a good idea, because that way if you do have radon in your house, you can have it eliminated so that you are not exposed to it. And that's especially important in this area, because we do have some areas in our area that have radon. So it's a good idea to get that checked. So we talked about the big things that can affect your lungs, but the only thing that we really can't do anything about is the asthma, because asthma is something that just develops on its own. We can treat it, but we can't prevent it. We can't cure it. We can only manage it and make it to where the patient lives a normal, full life, to where they are not limited by their asthma, because that's always the goal. But COPD and lung cancer are things that we can prevent, and the number one way you prevent it is to not smoke. And if you already are a smoker, stop smoking, because like I said before, the day you stop smoking is the day your lungs are happy, 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 and then they start working to repair themselves. So the more room you give them to repair that damage, the better off you are, the less likely you are to develop these conditions that we talked about. But if you do start having any coughing, any shortness of breath, anything like that, you definitely want to get checked out by your family doctor as soon as possible so they can determine if it's one of these, if it's something else, or if it's just a cold, or if it's allergies or whatever it is. You definitely want to get checked in with that local doctor that knows you well. So that is it for today. I'm Dr. Alancia Wynn, and don't forget to thank your lungs. See you next time.